I'm Chris Hoy, Director of Product at Vinyl, and I'm joined today by Odette Bolano, President and CEO of the Saint Alphonsus Health System. Odette, can you take a minute and introduce yourself?
Sure. As Chris said, I'm Odette Bolano. I'm the President and CEO of Saint Alphonsus Health System, which is part of Trinity Health, located in Livonia. We're in 22 states, and we're one of the largest Catholic health systems in the United States. And I'm a nurse by background, have been at the front line, many years ago, and happy to be with you today.
Excellent. Thank you so much for joining us. Thank you so much for your time. I know this is a tricky time for many of us. Before we do kick off, I will note for any viewers who might be watching this in late October, Odette and I are recording this several weeks beforehand. We're ready to get started. So Odette, St. Al's is obviously one of the largest health systems in the state and one of the key organizations here as far as helping Idahoans suffering through this pandemic. Broadly speaking, can you tell us about how COVID-19 has affected St. Al's?
As I reflect back, we are in our 28th week of being an incident command center, which, if we just think about how hospitals or other major disasters have occurred, they're usually, 1 to 2, maybe 3 weeks, and we're now into 28 weeks of being in this state. So back in January, I think we were all sitting back listening to what was happening in Japan and Italy. And then early February, we started to hear what was happening, beginning to happen in the United States with Seattle and New York. And we began to quickly, as a national health system, stand up our FEMA Incident Command Center in mid to late February. And by early March, we were full-fledged in incident command. And when you think about incident command, you have a very specific structure. And we had over 200 leaders in either sections or work groups trying to look at everything from work processes, from personal protective equipment, making decisions on how we changed processes, and really learning just in time. And sometimes you would make a decision early in the morning, and by the afternoon, based on additional information, we were changing our processes. So we pulled 200 people out of what they were doing back in February to be totally 7 days a week in incident command, really understanding what was happening and what we needed to be prepared for the pandemic and how it would affect Idaho. We learned a lot because as a national health system, we were able to get information about what was happening across the country, what were our sister ministries or hospitals experiencing as they were beginning to go through this. In middle of March, we made the decision, as many others, that we would literally cut off all our revenue streams by canceling elective surgery, elective procedures that we really focus on, making sure that we're providing wellness and prevention to our communities that we serve. And on March 16th, we literally closed those doors. We began to lock down the organization to be very ready for a COVID surge. And if we remember way back when, right, it seems like, a week is 8 months and a month is a year in this time frame. But if we think about back in March, the predictability models were very, very, they just weren't not mature enough, right? And so what we were seeing from some of the predictability models were numbers that were just staggering in the number of patients that we were expecting to see. And as the models got stronger and smarter and more analytics were being used, we saw that like by mid-April, late April, we had already gone through our surge. And, it was less than a mild flu for Idaho. And yet we had cut off everything and dedicated everybody's time and energy to COVID. Now we know that we are seeing larger numbers than what we've seen in the past, in early March and April. And so we are still standing up incident command, taking information, learning more, and really getting ready for what may be the next coming waves that will affect us.
Well, I'm curious, was there a moment in all that when it really hit you that the COVID-19 pandemic was going to be a very different challenge for you as a CEO from ones you faced in the past?
Oh, absolutely. I mean, when we started seeing the numbers and what was going on, and probably 4 weeks into incident command, and really the literature noting that this was going to be a long haul, it definitely was a different way of looking at what we needed to do. And I think as we got through April, there was a lot of fury of work and flurry of activity of how did we use technology to move us into a new space, right? So immediately in early March, we moved over 500 colleagues to work from home. I have to recognize Mark Winstrom, our CIO, and his team of just being able to deploy very quickly on that. We began to set up more aggressive ability to serve our communities through virtual telehealth and setting up our 76 clinics to be able to see patients through telehealth, also setting up virtual rounding so we could limit the number of times caregivers were going into rooms, since we were still learning about the transmission of the virus. We also, unfortunately, had to cut off all our visitation, right, to limit the number of people, not only to protect our colleagues, but to protect other patients. And so we had to quickly set up 150 iPads so we could do virtual visitation with patients and their families or loved ones in order to manage that. So immediately, technology was a critical function that we needed to learn how to use better. And of course, across the country, not only in healthcare, we've all gotten more used to being on WebEx and Teams and all those other things that we weren't as agile in using, and now that they have become very common to the way we conduct business. But I would say probably early March, there was a sign that this was going to be a very long journey for us and for healthcare and for our communities at large.
Those are major, fundamental changes to an organization, and you were forced to do them quickly. Did you find there were any capability gaps as you shifted from physical to virtual?
Well, I think we all started experiencing issues with the internet being overwhelmed, right? And so frustrations of people not being able to get on calls. I think that we all dealt with that. I think that we had to look at the bandwidth of our servers, right, to deploy all our virtual technology out to the use of our physicians, and quite frankly, retrain a lot of people, right? Our millennials probably caught on a lot faster than some of us that are baby boomers, and getting everybody used to that, and also how to help educate the community at large, our Medicare age populations that maybe didn't use or don't have smartphones, don't have the capabilities that we would need for them. So that was a lot of adjustment and a lot of troubleshooting. Our telehealth team that is led by Tiffany Whitmore, our VP of strategy, right? They were out there really troubleshooting on a daily basis. So yes, lots of work, lots of relearning, a lot of frustration, for sure.
I love that you're calling out the individuals who really helped St. Al's through this. That's cool, and leads into my next question. So with the general theme behind this year's Boise Startup Week being resilience, we wanted to know if you can talk a little bit about how either you've helped support your employees during this time, or maybe how they've demonstrated resilience.
Yeah. So resilience is something that we're all talking about right now, right? Because not only is this affecting us in our professional lives, and I would say from a healthcare perspective, our colleagues are even, first responders, EMS, and our, police force and social workers. I mean, if you look at all that, the frontline workers not only are dealing with what they are seeing professionally, but also dealing with everything that we're all dealing with, which is how this is affecting us in a personal manner. And resiliency is really important. You know, when you read articles, especially from New York, and you understand that many are suffering from depression and anxiety and, you know, post-traumatic syndrome that is showing up on colleagues that are dealing with death day in and day out, and how we have unfortunately isolated families and patients based on public health precautions, right? I think that resiliency is something that weighs heavily, at least for me, as the CEO of a health system. And we've set up our colleague care programs. Our foundations of each one of our hospitals were extremely generous in helping us set up an employee fund that colleagues could access. The community has been unbelievably giving to us. I mean, with treats and meals and all kinds of things for our colleagues to be able to be distracted from the day-to-day work has been unbelievable. I can't say enough about how well the community has supported us. But we have also deployed additional resources to our employee assistance program, to what we call our colleague care program, where we are assuring that our chaplains and others are going out, talking to our colleagues, understanding where their issues are, reminding our leaders to take time off, right? When you're going 7 days a week and, Saturday is no different than Tuesday or Wednesday, that is a significant issue with people being able to process and really put things in perspective. So we talk about resiliency all the time. Some of our town halls have been dedicated to what tools we have available for our colleagues to access in order to try to address their resiliency. So we will continue to work on that. I don't think that anybody has it totally figured out, but I do believe that as the pandemic continues to go on, the more and more we're going to have to use resiliency to help our colleagues continue to focus and be able to live in this environment.
Thank you for sharing that. I think, kind of my last question today. Do you have an operating model for bouncing back from COVID-19? And, kind of, I guess, a two-part question. How are you imagining things will have changed, for St. Al's once the virus does subside?
Yeah. So great question. About the middle of May, where we saw the numbers going down, of course, now we're either, you can call it our second wave or really our first wave of COVID across the state. But in May, we saw numbers dropping, and we knew that we had to open up our healthcare system. We all have heard that people have delayed their care, and we have tragic stories of people who are afraid to come to the emergency room or to the hospital or to their clinics, and they put off their care, which has created chronic issues for them or even worse. So in late May, like many other health systems, we began to identify that we had to live in the duality of being COVID ready and managing in that COVID state and opening up for the elective services that we provide. And so we are living in that duality every day, especially with some of the numbers that we've seen over the last 6 weeks of some peaks occurring or some higher numbers of COVID patients in the hospital. We are managing. We've created COVID-free areas. In our outpatient areas, we've put social distancing. We've used technology for queuing of patients, so we don't have waiting rooms anymore. We're using kind of the car as the waiting room and using technology to make sure that people understand when they can come in. But we have restarted elective surgeries. We have created, especially on the Boise campus, a true outpatient surgical area where we've separated that from the hospital, and we can have our COVID-free patients having elective surgery in a very controlled environment. We've developed COVID-free units for patients that need to come in for other services. It is interesting, and every health system is trying to manage, right, that duality, which it's an art and a science to do that. And we will continue to progress and adjust as we need to based on what we are experiencing of COVID patients in our health system. I think telehealth in the future, right, is going to be a much bigger part of who we are. I think we have other things like Care Connector, that digital front door, that patients will be able to interact with us through our website when they go to visit us. We will do a lot more within WebEx type online scheduling. We will make sure that we are focused on eliminating waiting rooms throughout our health system and using technology much more, because I think that this has opened up the silver lining in all of this is that we've learned to use technology in a much more robust way, right? And so I think that will continue to guide us, not only as a health system, but innovation to what you represent. How are we using innovation to resolve issues that we have encountered during this time?
Thank you so much for sharing all this today, Odette. It's really, I think, enlightening to learn how much you've had to do as an organization to work through all this, and reassuring, I guess, for me at least, to hear how resilient your organization has been in adapting to it. So thank you again for joining me. Thank you for the time. Thanks to everyone at Saint Al's for all you've done and continue to do. And we hope you enjoy the rest of Boise Startup Week. Thanks, Odette.
Thank you very much.